Hello my dear students, today we are going to study about body defenses, immunity and immunization. Okay, so let us start. What is a body defense? Okay, our body has, I can say God has crafted our body in such a way that it has its own immune system which can protect us from many diseases, right? Yes, so our body produces antibodies against various antigen which comes inside our body, right? And we have WBCs which plays a very important role to protect us from various infection through phagocytosis, okay? And our the cells are so smart enough that they remember that this particular antigen has come and they produce antibodies against this, and then what happens is next time when the same antigen will come in our body, they remember. So very nice mechanism which we are having. Okay, so body defense against infections may be local, systemic, non-specific, specific, humoral and cellular. Now this our body's defense, okay, our body's defense against various infection can be at these different levels. At local level, for example, if you get hurt, okay, there is a cut over here, nicely it starts to heal, right? So it can be either local or systemic, means the whole body. Either it can be specific, non-specific, humoral, cellular level, at the cell level, okay, that is at different level our body works for the defense. Okay, against what? Against various infection. Any antigen, this is what I said, any antigen. Antigen is nothing but something foreign body. Okay, it's not just a foreign body which comes inside, okay, and further causes damage. Our body remembers it and then produces antibodies against it. Okay, so any antigen entering the body may stimulate single or generally multiple defense mechanisms, not just one mechanism. There are many things all together working to protect our body from those particular infection. Okay, now here in FON, related to FON, we are only going to see very small part about body defense, immunization and immunity. In detail, you are going to study in microbiology. Okay, we are going to study in short. So let us understand what are the types of immunity. Okay, there are mainly two types of immunity. One is active and the second one is passive immunity. Okay, so in a simple form here I am brought for you what is active immunity. Active immunity is a type of immunity that an individual, okay, a person develops as a result of infection or a specific immunization. For example, in childhood, many people suffer from chicken pox. Okay, so whenever we get that particular virus which is affecting us, our body develops an antibodies against it, and then it still remembers. So once a person has developed chicken pox, the second time is a very rare for him to develop because the body already has produced antibodies against it. That is an active immunity. So we develop immunity in two forms, actively and passively. Okay, active immunity is the most common form where we protect our body from, okay, from various infections. Okay, so that is result of infection or specific immunization. For example, from childhood we are been immunized against various diseases. For example, we have been given, you must have seen children getting BCG vaccine. These are different vaccine which has been given so that the children can be protected from various diseases, communicable diseases, right? So this is what, not only communicable, non-communicable diseases also. Okay, so the individual develops as a result of infection or specific immunization usually associated with the presence of antibodies, microbial toxin or cells that have specific action on the microorganism concerned with a particular infectious disease. Now what you mean by all this thing is, we'll be studying more about this. In active immunity, our body tries to produce, the ultimate thing is when it sees an antigen, ideally it produces an antibodies, and these antibodies are so smart that they remember that this is the particular organism which had come, and the next time if the person is been infected by it, then he is protected. The simple form I said you, what is an active immunity? Next is active immunity develops against a particular organism or agent in the following 3 ways. That is what we are talking. Kaise? How is going to develop? How active immunity is going to develop in our body? The first thing is following clinical infection. Just I gave you an example. If a person is suffering from chickenpox, rubella, measles, okay, if a person is suffering from this particular type of disease, okay, then the body itself produces, okay, the body itself produces antibodies against it. Okay, once it has been affected, the next time there are very less chance that a person can again get a chickenpox. Okay, the first is following a clinical infection, means an infection has occurred in the body. As you know, you must be knowing the different clinical manifestation of chickenpox. You get blisters which are filled with fluid, right? So once the infection has occurred and it has cured, the person develops an antibodies. Next is following subclinical or inapparent. What do you mean by subclinical and inapparent infection? Which are asymptomatic. Asymptomatic means there are no signs and symptoms much seen. Okay, just example polio, diphtheria, or this is most common, following an immunization with an antigen that may be killed vaccine, live attenuated vaccine, or a toxin. Now what you mean by this is there are different types of vaccines which are available, okay, where we have killed vaccine. Killed vaccines means what? Here the particular organism is in the killed form and that has been instilled inside the person through an injection and the person develops antibodies against it. Okay, the next is live attenuated. Attenuated means what? Weakened. Okay, that particular organism or germ is been weakened in a weak form. It has been instilled inside our body and then the person develops antibodies against it. And the next is toxoid. Toxoid is nothing but the harmful toxins which are produced by that particular microorganism. That particular toxin is been instilled inside so that our body develops a particular immunity against it or antibodies against it. Like toxoid, we have tetanus toxoid, okay, which protects us from tetanus. Are you understanding? This is how we develop active immunity. Next is the types. Natural immunity is acquired from exposure to the disease organism through infection with the actual disease. This is an example which I gave you. If I am suffering or I have suffered, yes, I have suffered with chickenpox. So my body has developed antibodies against it, and next time whenever, if there are chance that I can get it, but there's a very rare that I will be suffering that particular disease because my body has already produced. Are you understanding? And the second, natural immunity, and the second is vaccine induced, means I am giving immunization. Okay, I am giving some vaccine to the person. Because of that, the person has developed immunity. Okay, is acquired through the introduction of a killed or weakened. As I said, live attenuated is nothing but weakened, weak form of the disease organism through vaccination. Okay, so these are the two types. First is natural. Second is vaccine induced. Next is passive immunity. The passive word only. What do you mean by passive? Where you don't have to take much efforts. Okay, passively it is coming to us. When antibodies produced in one body are transferred to another to induce protection against the disease, it is known as passive immunity, where your body is not doing anything but you are getting, okay, you are getting through someone. Okay, so most commonly a mother gives antibodies to the child, okay, to the infant. So when antibodies are produced in one body, example, a human being, a woman or a mother, okay, and she is transferring it to a child, then it is called as a passive immunity. How she is transferring? Through milk, okay, through breast milk or through placenta, okay. So that is called as a passive immunity. Other words, in passive immunity, antibodies are not produced in a person, but ready-made antibodies are administered. Okay. So one is a form where it has been transferred from the mother to the child, or sometimes we administer or give injections to the person. Okay. Directly we instill antibodies inside the body. Are you understanding? This is passive immunity. Now remember, active immunity, what we had, there's a natural one where you suffer a disease and there is a protection. which is developed by the body, or you are getting some vaccine, or you are taking immunization. Okay, but passive is you are been given antibodies where the body is not producing anything. Okay, you are been given it. So let us see further about passive immunity. So passive immunity may be induced through one of the following means. The maternal, okay, maternal means mothers. Maternal antibodies are transferred to the fetus through, this is what I said, placenta or breast milk. And breast milk. The fetus and a newborn till 6 months after birth have antibody mediated immunity. That is, how is the child or how is the infant having the immunity through mother? So it is called as antibody which he has got from the mother. Okay, that is antibody mediated, or that is a mediator, how he is getting immunity. Okay, that's why it's always very important that the child should be given proper breast milk. Okay. And next, the one is this commonly is happening, and the second is either we are giving some injections to the patient or to a client, administration of antibody containing preparation, that is immunoglobulin or anti-serum, that is we are instilling inside immunoglobulins to the patients. Are you understanding? That is coming as a passive immunity. Passive immunity, antibodies are administered inside or given from mother to the fetus, is called as a passive immunity. Hope so you understood. Very small in a concise way I've brought for you. In detail you'll be studying in microbiology. Okay. Next, what you should know is universal immunization program. Immunization program is one of the key intervention for protection of children. This is very important. Why we are having universal immunization program? To protect our children from life-threatening conditions. There are so many. Commonly, the children are affected from respiratory disorders, right? In order to protect them from it, we are having this universal immunization program. Okay, let us see what are the different diseases which are being prevented with this. So, under universal immunization program, Government of India is providing vaccination to prevent 7 vaccine preventable diseases. So, what are the 7 vaccine preventable diseases? Diphtheria, pertussis, which is also called as whooping cough, tetanus, polio, measles, severe form of childhood tuberculosis, hepatitis B, Haemophilus influenza type B, and diarrhea. Okay, now here if you can see, I have highlighted over here, you can see this 1, 2, 3, 4, 5. Now these 5 diseases can be prevented with the vaccine we call as pentavalent. Okay, pentavalent injection is been given. By penta means 5. This 5 diseases can be prevented with that particular vaccine. Okay. Now there are different vaccine we'll be seeing according to the age wise, how it is given, how much ml has been administered, okay, which area is been selected for administration of this medication. Okay, but I have just highlighted because further we'll be reading about pentavalent and you should be aware enough, right? So diphtheria, pertussis, tetanus, hepatitis B and Haemophilus influenza, that is type B, can be prevented with injection pentavalent. Okay, and next we will also seeing about DPT. DPT is nothing but those what all disease we can get prevented from: diphtheria, pertussis and tetanus. Okay, next we are also going to see about OPV, that is oral poliovirus vaccine. Okay, these are the different, and diarrhea is prevented with rotavirus. Okay, rotavirus vaccine is there. So let us see the schedule. So it is called as National Immunization Schedule, NIS, National Immunization Schedule. If you can see over here, we have BCG vaccine, okay, which is given for prevention of tuberculosis in children. Okay, and as you can see, it is given always, it is given at birth. It is always given at birth, but or as early as possible till 1 year of age. That means if it is missed, if that dose is not given, then you have to complete that dose within 1 year. Okay, and how much is the most commonly it is given 0.1 ml. Okay, and intradermal, this is very important. Where it is, how it is administered? Intradermal, that that particular mark remains. Okay, and you can nicely say whether the person has taken this BCG vaccine or not. Okay, it's always given in the left upper arm over here, left upper arm. Clear enough? Yes. Next is hepatitis B birth dose. At birth, most commonly is given. So you can see BCG, hepatitis B and OPV is given at birth. We always say at 0. Okay, so at birth this is given, or it is not given, then as early as possible within 24 hours. Okay, hepatitis B. 0.5 ml. Now it is what? Intramuscular. Hope so. Intramuscular means we are going to instill inside a muscle. Okay, and what is the site commonly used? Anterolateral side of mid thigh left. Okay, so on the left side we are going to give, and the anterior, this is anterior means this is anterior, posterior, so this is anterior latero means at the thigh region we are going to anterior side, but the lateral side, okay, mid thigh, where we are going to give this injection. Next is OPV. OPV is nothing but oral polio virus vaccine. Okay, you must have heard about been advertised about polio vaccine, that you have to give you have to give 2 drops to the children, right? So at birth or as early as possible within first 15 days. Okay, so 2 drops, and it's given orally. Next is OPV 1, 2 and 3. Okay, the first, second and third dose. So we always have 0, okay, and then 1, 2 and 3. So this 3 is very important, has to be given at the time of birth. Okay, at the time of birth. And then we give this OPV 1, 2 and 3, and this 1, 2 and 3 dose is given at 6th week, 10th week and 14th. This has to be followed. So you can remember like this: 6, 10, 14, 6, 10, 14. Okay, now how can you remember कि आगे क्या आएगा? So you just add on 6 plus 4, 10, 10 plus 4, 14. Okay, so 6, 10, 14. But don't, this just for your easy remembrance, I said it. Okay, so we give only 2 drops orally. Okay, so this is one. Further, there are many. Next, we give IPV, that is inactivated polio vaccine. Now this is given intramuscular. Okay, 14th week. At 14th week, we can give to the child 0.5 ml IM. Okay, now this is given anterolateral side of mid thigh, but on the right side. Now you have to rotate. Okay, you can't be giving it always at the one side. So this is given at the right side of the thigh region. Okay, next, this is what I was saying, pentavalent. Okay, that we have seen the 5 main diseases which it prevents from. That is why the word is penta. Okay, so first, second and third, again the same thing: 6, 10 and 14th week. 6, 10 and 14th week. How much it has to be given? 0.5 ml, commonly given IM, intramuscular. Okay, and this is given on the anterolateral side of the mid thigh, but on the left. Okay, on the left side. Rotavirus vaccine. Now this I said it prevents from the severe diarrhea in the children. Okay, so again the same thing: 6, 10 and 14th weeks, 5 drops given orally. Next we have measles. Okay, measles first dose is given at 9 completed months. Okay, it is given at the 9th month. That means once the child has completed total 9 months, after 9 months we can give him. So most commonly it's given at the 9th month, and 9 months to 12 months also you can give. Give up to 5 years if not received. It is said that give up to 5 years if the person or the child has not received in the 9th to 12th month. 0.5 ml subcutaneous, right upper arm. Okay, so right upper arm. BCG was the left upper arm, but that was intradermal. Okay, in the dermis. Next is vitamin A. Now vitamin A, this is given orally. It is given to develop good vision, also to have immunity also. It plays a very important role in immunity. So it is given, the first dose is given along with measles at the 9th month. And how much it is given? It is 1 ml, but we say it as 1, the main unit is 1 lakh international unit. Okay, remember it is given orally. Now this will take time for you to remember the all the site and ml, but at least you should be aware enough at what age what has to be administered. Okay, next is about a child. So first is DPT. Okay, we have seen diphtheria, pertussis, right, tetanus. So that is the first booster dose is given at the 16 to 24 months. Okay, 0.5 ml intramuscular anterolateral side of mid-thigh left. Now, OPV booster. Now, booster doses are always given to have enhanced immunity in the child. Okay, booster. So, again, the same thing is very easy. 16 to 24, there it was, if you remember, 6, 10 and 14. So, here is 16 to 24, 16 to 24 months. Okay, again, measles second dose is also given between 16 to 24 months. Okay, 0.5 ml subcutaneous right upper arm. And vitamin A second to 9th doses are given 16 months with DPT, as we have seen this 2 upper booster doses. Along with that, we can give vitamin A. Then 1 dose every 6 months up to the 5 years. Now, this is carried out with other what you can see here, as this is given, this is just an oral thing, na? So it can be administered along with it. Okay, so you just remember that vitamin A is been given along with DPT and OPV booster, and then 1 dose every 6 months. Next is, since first booster is there for DPT, there is a second one also. The second one is given in 5 to 6 years. Again, the same, you can see 0.5 ml intramuscular, which can be shifted to left upper arm. Okay, now since the child is grown up, you can, instead of giving in thighs, it can be given in the left upper arm. Okay, now remember, it is IM injection, not sub-Q, IM injection. And the last is TT, okay, that is tetanus toxoid, which is given, okay, to 10 at the 10th or the 16th year to prevent from disease, that is tetanus. Okay, it is given intramuscular 0.5 ml and upper arm. Hope so you understood the whole schedule. Okay, at what is given at birth, then followed by till what is given to the child. Okay, thank you.